We got another one here. We got diabetic neuropathy. And this one I like this story because it's a mild case of diabetic neuropathy. It's not the severe, I can never sleep, I can never, really it wasn't that bad. But
just
again,
more problematic for irritation.
Yeah, exactly. So this gentleman was 62 years old. He had a 5-year history of mild diabetic neuropathy. So his pain was rated between a 3 and a 4. And he hadn't really done a whole lot of different things with it. He tried some exercise, some stretching, some massage. He was trying to control his sugars quite well. He was on medications for this. Let's see, he was taking metformin, lisinopril, as well as a statin and drug to control his sugars. And he was working on controlling his sugars. He wasn't that good at it, though. So we had a little bit of an uphill battle. Not only had he had it for 5 years, but he wasn't great in terms of controlling his diet. And when you're not great at controlling your diet with diabetes, it means your sugar levels are up a lot. When your sugar levels are up a lot, that's active ongoing damage to the nerves. And so if somebody comes in to see us, one of the first things we have to do for diabetic neuropathy patients is make sure the sugars are controlled. Otherwise, we're going to be 2 steps forward, 1 step back.
Right.
Very frustrating. So his biggest complaint was actually that he couldn't ski. He could ski, but not really that well for very long before his symptoms would be escalating, and then so that was a frustrating piece for him. Yeah. And again, only 62. He's not old.
No.
Got lots of skiing ahead of him.
Not old at all.
No, not at all. Hopefully another 20 years of skiing ahead of him.
Exactly.
But if it's limited now, typically these things do get worse. Diabetic neuropathy does tend to get worse.
Well, most of what you don't address will get worse if you don't take action.
Right.
So.
Right. The sooner you can get on it, the better. In most cases.
In most cases.
One other thing was that he wasn't able to sit for longer than about an hour without his symptoms escalating quite a bit. So for the initial treatment plan, they recommended twice a week for 4 weeks. Again, I did see this patient personally, but so did several other practitioners. He did very well. This patient did very well through the first 4 weeks there of treatment and showed some immediate improvement. Again, I'll show you a graph here for this patient. So his pain did drop well within those first few weeks, and then it continued to drop and stabilize over the next period of time. So this is one where we have a little bit longer follow-up documented here, which is nice. But he had good improvement pretty quickly. He ended up having a total of 21 treatments over the span of 21 weeks. So initially, twice a week for 4 weeks, and then gradually spacing out the treatments from there, which is typically what we'll do with neuropathy patients. So you might have quite a few treatments, but it's spread out over, 3, 4, 5, 6 months in a lot of cases.
Right.
So improved extremely well, had no residual functional impairment after those 21 weeks. We did an additional evaluation 4 weeks into treatments, and he had no swelling, no pain with that exam. Full range of motion, was able to have good improvement in his ability to ski and his ability to sit. He continued to do okay with managing his diabetes. Hopefully he will continue, but we've not had to see this patient back at all. And he did very, very well with that treatment plan. So that one I think is a good illustration of, just because something's been around for a while and it's not that bad doesn't mean you shouldn't get treatment, because you can have improvement. And it's not even that many treatments that we're talking about, over a period of time to have good, lasting improvement. I mean, this guy started seeing results after the very first treatment.
Wow.
So that's not necessarily typical, but that does happen. We see patients that get better really right away, even with these things that have been, painful for years or very difficult, nerve damage.
Well, and if you can, this is a great example of improved quality of life. In being able to enjoy activity that they enjoy with some non-invasive therapy.
Right. Yeah. No injections on this one. No fancy supplements. 10 minutes or so of laser therapy and out the door, spread out over 21 weeks. So what is that? 5 months or so. I mean, really good improvement for very little investment, actually. In time and effort. So, yeah.
Well, and it just continues to progress.
Right. So. And most people that are using the right kind of settings and the right kind of laser equipment with neuropathy, even with diabetic neuropathy cases that aren't always the best control, still see very, very good results.